This conference will now be recorded.
Okay, good morning everyone. Today we are going to discuss about partogram. It is defined as a composite graphical record of key data which includes both maternal and fetal data during labor, and it is plotted against time on a single sheet of paper. Partograph was introduced by Friedman in 1954. It is the graphical analysis of labor for clinical evaluation of the progress of labor. In its simplest form, it plots the dilatation of cervix in centimeters and descent of head against time in hours. In partograph, we usually plot the dilatation of cervix and descent of head, and usually measure the time in hours. Friedman showed the pattern of cervical dilatation versus time of onset of labor. It is a sigmoid curve and it consists of two phases in the first stage of labor. Those are latent phase and active phase. Active phase usually starts from the 4 centimeters of dilatation of cervix. This is the Friedman's curve and it is a sigmoid curve. In this graph, we can see both the latent phase and active phase. And it's plotted against the cervical dilatation and time. It is further modified by Castle in 1972. They added both alert and action lines to the partograph. They also plotted the descent of head and they emphasized its clinical application. It was developed and extensively tested by WHO in 1994. The WHO partogram has been modified in 2000 and again in 2006 to make it simpler and easier to use. The latent phase has been removed and plotting on the partogram begins in the active phase when the cervix is 4 centimeters dilated. In WHO partograph, they removed the latent phase. The components of partograph. It usually contains the following components. First one is the identification of the patient. Next, we will record the time at hourly interval. We will take the 0 time for spontaneous labor. Is a time in spontaneous labor cases, we will take the time of admission in the labor ward as the 0 time, and for induced labor cases, we will take the time of induction as 0 time. Fetal heart rate is recorded in every 30 minutes interval. And we will assess the membrane state and the color of the amniotic fluid, and we'll mark accordingly. And we'll mark as I for intact membranes and C for clear liquor, M for meconium stained liquor, B for blood stained liquor. And next we will mark the molding. In molding, there are different grades. First one is this: when the sutures are opposed, it is grade 1. Sutures are overlapped but reducible is the grade 2, and grade 3 sutures are overlapped and not reducible. Next we will mark the cervical dilatation. Next, descent of the head assessed by abdominal palpation. We will palpate abdominally and we'll mark the descent of head in the partogram. And we'll write next the uterine contractions. Usually we will plot them in the squares like dots, and we will shade them according to the duration and intensity of the uterine contraction. Next we will write if we have given any drugs or fluids to the patient, then we will mention those in this partograph. Next, we will record the blood pressure at every 4 hours interval and pulse at every half an hourly interval. Oxytocin. In the oxytocin, there are usually 2 columns. In the upper box, we will write the concentration of oxytocin, and in the lower box, we will write the dose, urine analysis, and next temperature. Components of partograph. In the partograph, there are 5 components. First one is the patient information. We will write the name of the patient, age, gravida, para, date and time of admission. Next, fetal condition. In fetal condition, we will mark the fetal heart rate and the membrane, about membranes and liquor and the molding. Progress of labor, usually we'll see the dilatation of cervix and descent of head and uterine contractions. Next, we will mark these oxytocin, drugs and IV fluids. Maternal condition, we will monitor the blood pressure, temperature, pulse rate and urine analysis of the mother. This is the example of WHO partograph. There are various components like First column, we will write the patient information. Next, we will mark the fetal heart rate. Next, about the amniotic fluid, color and molding. In this graph, there are both alert lines and action line. Usually, it starts at 4 centimeters of cervical dilatation, alert line, and it completes at 10 centimeters of dilatation. We'll mark the descent of head, and time is usually measured in hourly interval. And next column, there are uterine contractions. For weak uterine contractions, which are lasting for less than 20 seconds, we will plot them as dots. For moderate uterine contractions, which are lasting for 20 to 40 seconds, we will plot them as straight lines, and we will shade for strong contractions. Next column is the oxytocin. In the next column, we will write the drugs and IV fluids. Next, there is BP and blood pressure. In the next column, we will mark the temperature and next urine analysis. This is the WHO partograph. And after in the labor, we will write the findings in these columns like arsins, membranes rupture, and everything. We will mention them. Now, advantages of partogram. Partogram is a single sheet of paper which provides the details of both maternal and fetal information at a glance. It can predict deviation from normal progress of labor early. It facilitates handover procedures. Introduction of partograph in the management of labor has reduced the incidence of prolonged labor and cesarean section rates. Early recognition of feto-maternal problems. Disadvantages of partogram. It assumes that all women progress at same rate, so it may influence the intervention rate. Clinical findings have subjective variations and lack of knowledge and non-availability of printed partographs. Principles of recording partograph. The active phase of labor commences usually at 4 centimeters of cervical dilatation, and we will start recording from 4 centimeters of cervical dilatation. During active labor, the rate of cervical dilatation should not be slower than 1 centimeter per hour. A lag time of 4 hours between a slowing of labor and the need for intervention is unlikely to compromise the fetus or the mother and avoids the unnecessary interventions. Method of recording partograph. First, we have to fill the patient information like name of the patient, gravida, para, and the hospital number, date and time of admission, and the time of membranes when the membranes are ruptured. Fetal heart rate. Fetal heart rate is usually recorded in a half an hourly interval, and it indicates the status of the fetus inside the uterus. Amniotic fluid. We have to record the color of the amniotic fluid at every vaginal examination, and we will mark accordingly. If the membranes are intact, we will mark them as I. And if the membranes are ruptured and the clear amniotic fluid, C, and for meconium stain it is M and blood stain B. Molding. Molding is a state of reduction or loss of space between skull bones. Presence of increased molding of the head high in the pelvis indicates CPD. CPD is cephalopelvic disproportion. Recording of degree of molding. There are various degrees of moldings, and 0 is the bones are separated easily and sutures can be felt easily. In grade 1, the sutures are opposed, and in grade 2, the sutures are overlapped, but those are reducible. In grade 3, sutures are overlapped but not reducible. Cervical dilatation. Cervical dilatation is assessed at every vaginal examination and marked with a cross. Begin plotting on the graph at 4 centimeters dilatation. This graph consists of homogeneous squares, 10 squares vertically. Each square indicates 1 centimeter of cervical dilatation. The cross in the graph are joined by a continuous line. Begin plotting on the partograph at 4 centimeters. We'll start at 4 centimeters of cervical dilatation and we'll plot on the graph. The climbing tendency of this line normally lies on the left side of the graph. There are 2 lines in the partograph. Those are alert line and action line. Line starts 4 centimeters of dilatation. The point of expected full dilatation rate of centimeter per hour. Action of the rate of 1 hour. Action line is parallel and 4 hours to the right of the alert line. These are alert lines and action lines. Alert line starts at 4 centimeters of dilatation of cervix and it ends at 10 centimeters. And usually action line is 4 hours to the right of the action line, alert line. Descent of head. This is assessed by abdominal examination before doing vaginal examination. Before we are examining the patient by vaginal examination, first we have to perform abdominal examination and we will see the descent of the head. And it is divided into 5 parts and will record a circle at every vaginal examination. This is the abdominal examination to assess the descent of the head. When the head is completely above the pelvic brim, it is 5/5 palpable. If the sinciput is high and occiput is easily felt, it is 4/5 palpable. If the head is in the pelvic cavity, sinciput easily felt and we will feel both sinciput and occiput, then it is 3/5 palpable. Occiput was just felt and sinciput is felt. If we feel the sinciput, it is 2/5. And if it doesn't feel occiput, it is 1/5 and none of the head is palpable abdominally. It is completely in the canal. Hours refers to the time elapsed since onset of labor. We will usually take it in hourly interval. Time is recorded. We will record the actual time. Uterine contractions are recorded graphically on the partograph according to the strength and frequency. Observation of contraction is made half an hourly in the active phase. In the active phase, you usually monitor the contractions for every 30 minutes. Palpate the number of contractions in 10 minutes and the duration in seconds. For less than 20 seconds, we will shade them in dots, and 20 to 40 seconds, we will shade them in lines, and more than 40 seconds, we will shade thickly. Oxytocin drip. Oxytocin drip. This consists of 2 lines, one for record of unit of oxytocin per liter of IV fluid, and the other one is for drop of fluid per minute. The recording can be made at the interval of 30 minutes as the same as the uterine contractions. Drugs and IV fluids. Record any additional drug given and are recorded at the particular point of time. These include sedatives, antibiotics, IV fluids, etc. The name of the drugs and doses given should be written clearly in the long box. Maternal condition. We'll record pulse for every half an hourly interval and we'll mark the pulse as a dots, and blood pressure was recorded for every 4 hours and marked with arrows. Temperature was recorded in every 2 hourly interval. Urine record. We'll record if there is any proteinuria or anything in the urine. So we'll record for protein, acetone and volume when passed. During the course of labor, the examination of urine is important. In case of maternal distress, the volume of urine may decrease and it may contain ketone bodies. This is the partograph which is plotted. There are different types of curves in the prolonged labor, which normal labor is the sigmoid curve and the others are the prolonged labors. This is the WHO graph which contains both alert line and action line. Electronic partogram. Electronic partogram is a tablet-based application developed to improve care for women in labor by addressing documented challenges in the partograph use. The application is designed to provide real-time decision support, improve data entry, and increase access to information for appropriate labor management. Conclusion. Partogram is a simple, clear, easy to use and cost-effective tool for monitoring of labor and decision making. The use of partogram significantly improves perinatal outcomes. The partogram can be effectively used at any level of care. Thank you.